communicating health innovation. SXT is a little project that I set up 5 years ago now with some support from a number of people, and thank you guys in St. Thomas's Charity. But the big problem I was facing as a clinician was that users were frustrated about poor access to services. There were time-sensitive services they were not getting access to appropriately, and of course there were poor health sequelae because of that. And then there was a mismatch between the providers that exist and the capacity that has, and the demand that there are from patients. So you found that mismatch meant that people were queuing up to go to one place when there was somewhere down the road that it could be managed effectively. And the image online was really patchy. It was in the control of IT and communications departments in trusts, and not in the hands of frontline providers, and that's what I really wanted to address. So SXT is a relatively new website. It's provider controlled, so you can communicate what you offer, and it helps people find the right service in the right place at the right time. And communications is something we thought a lot about from the beginning, because nobody was doing anything like this initially. To make it succeed, we had to obviously raise awareness, and you're in a catch-22 when you don't have enough providers in your database to start with. So we had some early adopters, and thanks to all of those, and then we also uploaded from various databases, providers, and we could show it working with SMS, and then we moved to mobile and web, as SMS was less useful in this sort of domain. And convincing people to use the new tool meant that we had to always get data out. So our approach was not only to make a really nice, user-friendly interface website, but we also wanted to make sure that the data came out so we could then report back to people and say, do you know what, this is working. You can look on an analytics page and see people using the platform to find your service. And it was only latterly that I got some specialist support, but I found that really useful way of approaching the sort of the communications journey in an alternative fashion, by speaking to people before things were launched, as opposed to launching things, measuring them, and then evaluating them. And this is the website. I put a card on everyone's table, so if you want to check out the website, please do. If you know anyone who needs a service, then this is the place to go. And we just upgraded in June this year, and we've had 6,000 users since the end of June, which is fantastic, with great detail about who's using services. And when people choose a provider, 16% are giving feedback, and we've got a net promoter score of 8.8 out of 10, so we're having about 80% of users giving us a score of 8 or more out of 10 when they find a service. There's many audiences that we had to talk to. We had to talk to providers and encourage them to think about it. We had to talk to commissioners. We had to talk to members of the profession, obviously, and then the most important thing is talking to clients, finding out what they want. And they want something that works quickly. They want something that just delivers, and as quickly as possible. So it gives information in under a minute about what is available locally. And we use different ways of trying to get people to use the website. And still, I'm finding the hardest thing is getting websites to feel confident about posting a link up there. So I've just got a new emergency contraception calculator that I think is going to be my hook into various clinics, to get an icon and a link to the platform. But that's one of the big challenges. But we use paper, we've used ad tags, we've used Google Ads, and many other ways. But it's important to make sure that you communicate in a way that people understand. So just to give two diverse examples, on your left is some stills from an animation, Tom Meets SXT, which is a sort of raunchy 2-minute YouTube animation about partner notification for men who have sex with men. And the third image with the red face is the difficulty people have about telling partners, for example. On the right is a dashboard that I'm working with the company Aileron. We're communicating out what's happening on the website in real time and sending that back to providers so they can see who's using the website, why they're using the website, and the sort of traffic that is happening on SXT. So we use many different ways of communicating, and of course, as the data starts flowing, it makes it possible to start presenting at conferences and invited to write articles, etc. And that's a really helpful way of speaking to the profession. But it's very difficult sometimes to measure what is working. And with things like Google Ads, you can see a conversion rate and you can see people coming on the site. But when you're giving out cards or you have posters, or it's difficult to actually convert that activity into real use of the site. So we've been, since the very beginning, really reflecting on exactly what works the best. Guys and St Thomas's Trust gave a small grant to SXT to put ad tags up everywhere, which are 2D barcodes and near-field communication. As an early adopter, I put these up all over Lambeth and Southwark, and hardly anyone started using them, even though I had some really great early data. So it's easy to obviously get there too early or try things that don't work. But capturing the feedback is key, and of course I told you about the Net Promoter Score, and we do that for every single service that we're delivering. And yeah, it's just nice to try new things and see what works. And the new thing is Bluetooth beacons. I'm not sure if they're going to work out, but it might be nice to try that if anyone wants to do a project. But finding the right voice is difficult, especially when you're early on and people don't really know what you're going to be in 4 or 5 years' time. There's a sense of, oh, do I take a punt with this person or not? And when I got a grant recently from the Cabinet Office to develop the emergency contraception calculator, Alaron said, well, why don't you start speaking with the commissioners first and GPs and others before you've actually finished it? So that was a completely new thing for me to actually start talking about something before we delivered the baby, so to speak. And it was a good approach. I learned a lot thinking that way, and of course now it's gone live. We're starting to disseminate it. And yeah, finding key messages is key, and it's all about looking at the data that you collect. So one of the big things that SXT has developed, and it went live at the end of January, and I'm just going to sort of speak to this because this is changing how the profession is delivering service. It's very hard when you find someone with a new infection to get their partners told. We know at least a third of partners will have the infection diagnosed in the person in the clinic, and that's true for all STIs. This is a challenging area. It's always been the hardest problem to solve in sexual health. So SXT, because it helps people find services, we thought, well, why can't we help partners find services once we know someone has an infection? So it works in the clinic, it works on the bus on the way home for the person with the infection, who's called the index patient. And then when the partners turn up to any clinic across the UK, they get an optimal service. And it's a text message that we send out, and it's an anonymous platform, and then they click on the link and it opens up a web page that tells them what to do, and it gives instructions to the clinic on what they should do with this person, and it gives instructions to the clinician on how to unlock this unique code and find out what that person's been exposed to. And this is a really impressive piece of communicating in a way, because we're talking to people who've never even contemplated going to a sexual health clinic, so it's actually, we're really breaking new ground, and it's not an easy message to send to anyone who is a partner. But it's also very difficult to communicate all the volume of data back to clinicians. We've done this for many years, but it's actually hard getting the data out and showing that it's effective. So we created a bullseye figure to actually talk about partner notification. So we've had 1,313 index patients, that's people with STIs, using this platform. And the grey circle represents the total number of partners they declared in clinic. The maroon is the number that they can contact. The light blue is how many they've actually told with the platform. The dark blue is how many they actually told open the link to actually find out about what they've been exposed to. And then the bullseye, the pink, is how many of those partners actually turned up and were verified as seen in a clinic. And this way of communicating is never been done before for partner notification, but hitting the bullseye is exactly what we're trying to do, and that's the public health story that we need to tell. And it's different for different STIs. So HIV is different to syphilis, is different to trichomonas vaginalis, and trichomonas vaginalis is seen mostly in the heterosexual black community, while syphilis is mostly in men who have sex with men. And I've got a poster at the STD Prevention Conference in Atlanta talking about and also Public Health England next week, talking about how these different diseases sort of unravel how different groups communicate with each other to try and deal with these epidemics. So the top lessons are that you need to really think from the very beginning about what you're doing, and especially if you're doing something brand new that nobody knows about, and sort of holding the hand of people around you and saying, this is the vision and this is what we're trying to achieve. It's really difficult at the beginning when you don't have data, but the key is to get as much data as early as possible. And then keep on talking to people, keep on iterating. Everything that's been built has been built with providers, with clients, just to make sure that it works for them. And then when it comes to getting people to know about the site, it's using different tools to try and do that. And some work better than others, and some work, but you just don't see that for many weeks or months later. And then, yeah, assessing it all the time. So in the back end of SXT, there's really strong analytics, but we're using Google Analytics as well and other platforms to see how it's working. And then telling the story before you finished is something I'm getting used to, because I can now see that it's actually adding value, and the plan is to obviously scale up as much as possible and keep on telling a story with really good data.